Good evening and welcome to the first in the series of WLS Info webcasts. First topic is setting up support groups. WLS Info has a long pedigree. It was established in 2003 as around about 19,000 members, and it's been directly involved in 30 peer-led support groups around the UK and Ireland. This is me. An old picture of me with the man who before his gastric bypass and a man a few years ago after a gastric bypass. I'm the chairman of WLS Info. My name's Ken Clare. I had a gastric bypass in 2002. I'm a bariatric specialist nurse. I'm the co-facilitator of the Liverpool Support Group, and I've recently been trained by Bariatric Support Centres International to be a support group leader. People often ask me, why should we set up a peer-led support group? The benefits are well documented in the research and evidence, and it says that people who attend support groups have better outcomes, including weight loss, less side effects, and less mental health problems. Mutual support can provide a level of support that professionals can't. People often say only fellow sufferers understand the real meaning of being obese and going through the weight loss surgery journey. It gives us an opportunity to work through problems together, often finding innovative solutions that are unknown to healthcare professionals. In theory, groups develop healthier lifestyles and can often work together to promote these changes together. The groups undoubtedly perform a huge social function, and each group has a healthy social outlet as part of its development. When looking to set up a support group, certain factors should be taken into account. It's an important decision about where to base your support group. You've got to bear in mind public transport and what's available in the local area. Bear in mind car parking. Is it safe? Is it accessible? Is it friendly to vulnerable female? Safety is an issue. Is it in a safe part of town? Is it in a part of town that's populated by a lot of children who could ridicule some members who are attending perhaps for the first time? Consider that. Consider whether it's going to be in a part of town where people have some degree of anonymity, where you can just be popping into a hospital or to another group for something else. You've got to remember that not everyone who attends your group will want to be identified as somebody who's having weight loss surgery. Also consider the following. Seating. The ideal room would be on ground floor level with bright spacious windows with net curtains facing a lovely sunshine and a lovely evening coming in, open up windows that can be opened or air conditioned. Most of the time we don't have that. Bear in mind that we should have chairs with no arms that are easy and comfortable to sit on. Buildings should be accessible in terms of stairs, ramps, lifts, etc. Toilets. Again, an important issue, and some of our clients will be in wheelchairs, so you've got to bear that in mind when you're looking at any prospective premises. The availability of what night of the week or day of the week, what suits you, and what is available in the long term as well. Another major factor is cost and affordability. If each group had £500 per session budget, we could all find a lovely hotel where we could all meet and be very happy ever after. Unfortunately, it doesn't work out like that, and compromises are made. Leadership. That's a dreadful transition, and I shall never use that again. More than one leader per group is essential. We started off in the past with just one leader, but we found that people often found this an incredible stress, or let it get to them, or it worked the opposite way sometimes, and people will become power crazy. Move as soon as you can towards a committee type management, so you feel you can have a night off with a clear conscience, and it'll still go on. We want the group to become long term and not an albatross hanging around your neck. Share jobs out. It's important that you don't do everything. People like to do things, and it helps them in their recovery to help other people. Involve everybody who attends, even if it's a simple job such as giving out the tea or greeting people or making sure that people are welcome. Try and involve as many people as is humanly possible. Try and get yourself some support. That can always be available via your bariatric team or via a charity like WLS Info. And you'll notice I keep plugging us several times throughout this presentation. All leaders, we believe, should have an awareness of the good principles of good aftercare and should apply them at all times. We're not looking for saints, but I think it's really important that you know the principles. Money, as we talked about before, is a contentious issue and can often cause problems. Try and keep your expenses to a minimum, mainly for the room and for tea and coffee. If a group can just pass a pot and cover all the expenses, that's the best way for it to go. Keep records of how much money that you collected, not by each individual person, and stress that if people don't feel they can give that particular month, then that's okay, they can still come. We find that groups where a minimum donation is specified tend to be exclusive and keep people away rather than encourage people to attend. Seek external help for money, and a lot of that is available from us at WLS Info or other suitable charities out there on the high street. People often ask me what sorts of speakers they should get. Bariatric surgery providers are often a fine example. Persuade your friendly local bariatric surgeon to come along and talk to the group. They have a duty of care, and it can be a good way for people to see them. Make it into a bit of an occasion. People get dressed up and want to show off to the surgeons how well they've done. Get reconstructive surgeons around. This is a term that's being more popularly applied now to plastic surgeons or cosmetic surgeons. Make sure that people know you can't, and indeed for those two types of speakers you shouldn't pay, because they'll probably be getting something out of it themselves. Use contacts within your group. Ask all members of your group what they do for a living, what their husband does, who they work for, who they know. Is there someone at their golf club or church or whatever who you can get along? Do they know someone who's a Colour Me Beautiful or an Avon rep? Don't bring along an Ann Summers party or something like that. Try and keep it open and accessible, and remember that it shouldn't offend anyone within the group, but it should be broadly relevant. Life coaches, try and think outside the box. Don't just think about surgeons and dietitians and here's someone to give us a talk about lettuce. Although having said that, a talk from an allotment association might be very interesting. Bit of grow your own and organics. So I'll just make a note of that for the next session. Keep records of who comes, and also speaker wise, and also which members, and keep a note of their mobile numbers and email addresses, so if a meeting is cancelled, often in the winter due to weather, then you can contact them. Encourage people to get buddies and to ring each other and say, when you feel like picking up the food, pick up the phone. Group activities. What can you do when you get them there? I'm sorry that a lot of this, for anyone who's been to any of the anonymous groups, the 12-step Alcoholics Anonymous or OA or NA or Gamblers Anonymous, you'll recognise this. I'm a member of one of these fellowships, and I do think that they lend themselves a good way of dealing with these things. A preamble that's read out at the start of every meeting that just says what you're there for, what you're going to do, what you're not there to do, and so everyone knows the ground rules. Introductions, basic introductions, try and limit people. Some people you get there will speak for too long, all about themselves. I've only ever had to evict a couple of people for not shutting up. hopefully it'll never come to that for you. Try and use techniques, joke, cajole, and then I think at the extreme, say, well, there's 31 people in here and you just spoke for 40 minutes and we've only got an hour left, so seek help from any source. We can help you a lot, as can other charities which are available on the high street. Spread the word. Local surgery providers can be great in telling people about your group. It might take a bit of time because they've got to decide that they approve of what you're doing. They might be a bit scared. Weight management clinics, again, they're often a bit less scared of you than local surgery providers. Use WLS Info, BOSPA, Facebook, other groups on the internet. Maybe your local council for voluntary service, GP surgeries, or just ask members to disseminate information. Have a special evening words, bring a friend, get them to come along. Everyone's got a friend who needs surgery. Just get them to come along and see what we're about. If you need help, please ask. Get the team locally. Get weight loss charities, we've already mentioned who they are. And there is some training becoming available. And this is something that I know that we at WLS Info, I think that's 7 times I've mentioned us now, want to do more of this year. So if we feel we can help, get in touch with us. Any more questions, please contact the support team at WLS Info. We'll help where we can. Our number is, I'm not giving you a number, although it's 0151 222 4737. But the best way to catch us is support.team@wlsinfo.org.uk. And in the words of those immortal cartoon characters, that's all, folks. I'd like to apologise for some of the people who've had to sit through this first draft of my podcast, and I'd like to apologise to the rest of you for some of the crap jokes and shit presentation skills. This will be improved once upon a time. Many thanks. Good night.